Well, hi, everyone, and welcome to our webinar today. We'll get started in about 1 minute's time. In the meantime, it'd be great to see where everyone's dialing in from. I myself am in Vancouver, Canada, and Tom, whereabouts are you?
I'm based in Brisbane at the minute. Was Melbourne, but now Brisbane.
Okay, awesome. Yeah, in the chat window, it'd be great to see where everyone else is dialing in from today. And we will get started very shortly. Thanks, everyone. And for those that have just joined, we'll get started in about just under a minute's time. Well, hi, everyone, and welcome to our demo today and webinar on sharing your impact with the world. I see many people dialing in from Melbourne, and I hope everyone is safe. I understand there was an earthquake there today, and we hope that everyone is safe and it wasn't too disruptive to your communities. And welcome, everyone. I also see we've got someone dialing in from Costa Rica. That's incredible. Indonesia. Where else? Just again, I'm dialing in from Vancouver, Canada, and my colleague Tom here is dialing in from Brisbane. Okay, great. Well, thanks, everyone. It's great to see everyone joining us today from all different places. So thank you for joining today's presentation and demo on using impact measurements and sharing your impact with the world. It's presented by Social Suite, a global leader in impact management software. My name is Christian Mosley. I'm the head of business development at Social Suite, and I'm joined today by our lead impact advisor and presenter, Tom Latimer. Social Suite's mission is to help all organizations show the change they are making. We work to accomplish this by producing technology that helps a diverse range of organizations monitor their impacts on people. Our products make impact and outcomes measurement more widely accessible for nonprofit organizations worldwide. Social Suite removes the barriers to entry to impact and outcomes measurement by providing a cost-effective way to gather feedback, measure impact, and report back on that impact, helping organizations such as yours measure and show the important changes they are making, while also charting new pathways to revenue. If you have any questions in the presentation, please feel free to type them in the chat box via the chat feature. I'll be monitoring and I'll try to answer if I can in real time. Otherwise, we'll save your question for the end during question and answer time. We'll also be recording today's session and sharing it with you afterwards for future reference. And without further ado, we're going to jump right into it. I'd like to introduce you to our lead impact advisor, Tom Latimer. Thanks, Tom.
Thanks, Christian, and hey, everyone. As Andrew said in the chat box, I hope everyone in Melbourne is safe after the earthquake. But really, sort of from today's session, what I'd just really like to cover is, I guess we work with a breadth of organizations, and we see quite a lot of common challenges on organizations' journey. We'll probably, hear us use that word quite frequently, journey, because it is an iterative process and it does take time on impact measurement. So, just go through some of the sector challenges that we see, run through how technology can sort of help alleviate some of those challenges, and then run through some dashboarding examples, including a real life use case of Scope Australia, who is a large disability provider here in Melbourne, and just kind of going through their dashboards and how they report to various different stakeholders as well. Just before we do dive in, I'm just going to put a poll on everybody's sort of right-hand side of the screen. It'd be really good to understand where everybody's at on this call on their journey. Whether they haven't started yet, whether they're currently just discussing and aligning internally with stakeholders, whether you're in the process of developing those metrics and theory of change, or whether you've actually done that and you're sort of ready to hit the ground running and embed that into a technology solution. A few answers sort of coming in, quite a mixed bunch. Some haven't started, some aligning, different parts of that journey. And to be honest, before even getting to developing the questions and the theory of change, there is a bit of that journey internally. As I said, aligning with different people within the organization, understanding what you want to measure, why you want to measure it. But what we sort of see within the sector is that a lot of organizations are quite competent in being able to demonstrate program output. So what we would deem as an output is, tell me number of people that have gone through your programs, or tell me number of sessions that you've held, just more of those output-driven metrics. As most organizations are probably facing those, that funders, grant applications, the board, and a pressing need internally to understand, what is the impact that we're delivering. There's a lot of pressures coming to actually demonstrate the outcomes over time, and that's really where we see organizations become a little bit unstuck, because it's about collecting data in line with the overarching outcomes and theory of change from individuals over time, and then being able to look at that from an individual's perspective and their journey, but then being able to aggregate across groups of people, across various different programs as well. So when we see organizations that want to transition away from just reporting on outputs to outcomes, there's a bit of a journey again that we see organizations going on. So first of all, obviously not measuring outcomes whatsoever. They then don't have capacity internally, don't have capabilities, resources. So they may engage an external third party. This could be a consultancy firm, somebody that would generally come in and do a one point in time retrospective assessment about potentially one program. Get a 200-page report of that 3 months after the fact that program's been delivered, not gaining those continual insights on that data, and it's quite that static report. So then when organizations want to then bring that in-house, and for those that answered sort of ready to implement, potentially you're even currently measuring, this may be applicable, but using a lot of disparate tools and systems in order to measure the impact. So this could be a lot of paper-based data collection. It could be utilizing things like SurveyMonkey or Qualtrics, really things that are designed for that one touch point, more satisfaction-based impact. So what we see the challenges with those tools is that, first of all, you're collecting data at one point in time, extracting that data from, let's say, SurveyMonkey, attaching that to your overarching outcomes for reporting purposes, but then having to remind yourself again to do a pre-program collection, extract that data, try and map that to the old data, generally in Excel spreadsheets to get that visualization. There's then a board meeting, and then there needs to be a board report, and there's a mad scramble of Excel spreadsheets. So really what we're trying to do is to bring all that into one system, and that's really what Social Suite does. So first of all, there's really three key pillars to the Social Suite platform. First of all, it's actually about building, what are we trying to measure? So what are our outcomes, what are our indicators, and what are the actual metrics and rating scales that we want to measure and collect from our beneficiaries? It's then about tying that back to different programs or initiatives that you might be running within the organization, and then defining, okay, well, at what points in time do we want to collect that data to be able to demonstrate the change over time that we're having. So that could be a pre-program, a post-program collection, and then potentially a 6-month follow-up. And then, as many would know, there's different, environments and vulnerabilities that make it challenging to actually collect data. So within Social Suite, there's multiple ways that can be done. So whether it just be, you have the email addresses of the individuals and you can send it straight via email, SMS, you've got group environments, so you're in the field and you might need to collect it on a one-on-one basis using a mobile device. multiple different ways that you can actually capture that data. But then most importantly, it's about bringing all that together. You could have run multiple different programs, different points in time of data collections, different methods of collecting that data. But ultimately, you need to bring all that together in a digestible way where you're able to understand, are we delivering the outcomes that anecdotally that we know we are doing? Do we need to collect data from other reviewers as opposed to just the beneficiary to get a wider perspective on whether our programs are delivering the outcomes that we feel they are doing? But ultimately, these reports then in real time, can we provide them back to the frontline staff so they understand the great work they're doing, backed up by that factual data? Or then you've got reports to be able to grant applications for the fundraising team, internally to help improve service delivery. Or if you've got philanthropic funders that you need to be able to demonstrate the impact to, you can extract those reports in real time. But ultimately, having that end-to-end system, you're not having to do that manual data extraction, cleansing pivot tables to try and get some form of visualization across that as well. So hopefully that sort of sets the initial scene. Before we go into a bit of a demonstration of the technology itself and go through the reporting elements, if anyone's got any questions, feel free to sort of pop them in the chat box as we're going along. But it'd be really good just to understand the challenges that the organizations are facing about getting started, because there's a few different reasons as to why an organization would struggle. So I've just popped up another poll on the right-hand side. Whether you don't know where to start, whether it's budget and funding constraints, unsure as to what the questions or the metrics to ask, or whether it's sort of internal capacity and skill set as well. And just as we're answering that, I'll just share my screen. Okay, so interesting response as well. Don't know where to start, budget and funding. And that's quite common. So a lot of organizations are unsure what they should be measuring, how they should be going about it. We do actually run a bit of a workshop process with some of our consulting partners to help organizations start that journey of developing those metrics and theory of change before even getting to a point where technology can sort of be useful from that perspective. So yeah, if anybody's interested in understanding a bit more about that process, then feel free just to pop that in the chat and we can reach out after. But really it's about developing those metrics so that you're ready for a technology solution to help streamline that process. So when we really look at Social Suite, the first point of call is actually what we call the templates library. So a template we would deem as a group of outcomes, indicators, metrics, or a particular framework that you want to utilize to measure across a particular program or initiative that you're running within your organization. So that could be a completely customized template that you developed internally, you've had developed from an external consultant, or there's plenty of other frameworks that have been developed by other academics, other organizations, things like the Conor Davis Resilience Scale, the World Health Organization Quality of Life. They can be embedded then into your library to then apply to a single or multiple things that you run as the organization. So if we take an example here, sort of people within Australia are probably quite familiar with the Personal Wellbeing Index that's been developed by Australian Unity. So really what we can see here is all of the outcomes that we're looking at being measured. Each of those outcomes then has an indicator of how you're actually measuring that, and then the question that would form the basis of that survey and that rating scale as well. So again, the challenge with something like SurveyMonkey is that yes, you can ask the question, but then from a reporting perspective, you're having to map those responses back to those overarching outcomes. And in some circumstances, you could have multiple questions that attribute towards one overarching outcome. So that can make it quite confusing. So from a Social Suite perspective, you're setting that up beforehand, which eases that reporting further down the track. Then it's just about setting up, okay, well, what are we actually running within our organization? So again, what we find is with Excel spreadsheets and reporting, you can maybe get a high level view across a whole program, but how can you start to disaggregate that data back down via sub-programs or groups or cohorts of individuals? So what you're able to do within Social Suite is first of all define, okay, what is this overarching program that we're actually running? And then we can segregate that down further into sub-programs or activities. It could be like workshops or day programs, wherever it may be. And then you can segregate that further into what we call cohorts or groups of individuals. So again, this becomes really powerful when you get to a reporting perspective, because yes, you can see an individual's change over time. You can then start to go, okay, well, we can look at a group or a cohort to a cohort, activity to activity, or get the high level program perspective as well. In this instance, you can see that we've just put the cohorts as geographical regions, which is suburbs surrounding Melbourne, but they could be anything that you would define. But essentially then it's about defining, okay, well, these are the programs and activities we're running. These are the groups of people that are going to be participating. We know the outcomes and the indicators and the metrics we want to measure, but it's then tying that back to who we actually collecting data from. At what points in time do we want that data to be collected? And also, what is the method of collection through those surveys as well? So we can see here in this case that we're collecting data from the beneficiary pre-program, post-program, 6, 12, 24-month follow-ups. We're sending that out via email in this instance. So essentially the platform knows, okay, we know who we're collecting data from, we know what we're collecting, we know how we're collecting it, and we know what time point. So you're not having to remind yourself, again, time consuming for somebody to do a post-program, remind themselves through a 6-month follow-up. The system's going to do that automatically for you. So again, that just helps organizations save copious amounts of time. And we've actually got a bit of a document use case of Top Blogs, an organization sort of based in New South Wales. And essentially they were using SurveyMonkey, Excel spreadsheets, utilizing Social Suite, particularly around this area. They were able to save 540 hours in reporting time. So, quite a considerable amount of time. So we'll ensure on the follow-up with the recording, we'll also send that use case out within that email as well. So essentially then, you've got multiple programs running, you've got multiple surveys being collected, multiple time points. As I said, it's about bringing all that together to make it in a digestible format where you can utilize to understand, improve service delivery, what is driving more impact than other initiatives we're running. How can we extract and provide this report to the board? How can we provide this report for fundraising efforts, and just have that at the click of a button, because you've got the rigor to the whole process, the data structure in place already. So if we take this example, and it's worth noting that all of these dashboards can be completely customizable based on an organization's metrics first, or what you're trying to measure, but also what demographics do you want to be able to slice and dice the data by, and we can sort of help construct that. So again, if anybody on this call is interested in understanding how the reporting element, what you'd be able to achieve based on your own initiatives and perspectives, again, pop that in the chat and we can follow up and have a sort of more of an in-depth one-on-one call. But we'll just go through a few different dummy examples. So in this case, we've got a youth work readiness program. We can see this at a very high level, so it's across 115 participants. We've got the outcomes that we're trying to achieve as the heading. So career and educational planning, digital skills, work and study life. We've collected data from pre-program, post-program, and a 6-month follow-up. In this instance, the questions were just a Likert scale out of 5. So we've just represented that as an average in a bar chart format. So across all participants, you're able to see that change over time in line with those outcomes. Now, then what you're able to do is start to interact with these dashboards, and you can start to use multiple filters. So you could use the things like the activity and the cohort filters, but also any demographics that you capture against your individual contacts, you can utilize as that filter as well. So we could start to go, okay, well, how were the outcomes achieved in Collingwood to that of Epping in this case? Or we actually want to see across the whole program, how did males go that identify as Aboriginal and Torres Strait Islander, as opposed to females that identify as Aboriginal and Torres Strait Islander? So again, all those demographics could be customizable depending on what you would want to be able to slice and dice that data by. So that's one example. Another example is a mentoring program. So this is quite a good example because it shows collecting data from the beneficiary themselves over time, but also then collecting data from another stakeholder, another what we call reviewer. So in this case, we've captured data from the mentee. We've also captured data from the mentor about the mentee. So it's a different perspective. So again, very high level. Our cohorts in this case are just major cities. We can also drill down to an individual level if we would need. But essentially, this is looking at females' confidence in applying for leadership roles. And we've captured a baseline, a 3, a 6, and 9-month follow-up. And you can see pre-program at 17% felt confident, but 75% felt confident post-program. So you can see, that significant change from pre to post. But then, what is the mentor's perspective about it as well? And you can start to see, although the data is not exactly the same, it's a strong correlation. So it helps paint a bit of a wider picture, multiple different ways then of representing that data to show that change over time. So that's another example. This example is good because it starts to show how you can look at the data from a geographical splitting standpoint, but also how you can start to bring in a lot of those output metrics that we briefly touched on before in line with the dashboards of your outcomes. So what we can see here is one of the outcomes that we're looking at is people who've experienced prejudice and discrimination against Aboriginal and Torres Strait Islanders within a 3-month period in the workplace. So again, very, very high level, we can see total number of people reached, dollars deployed, volunteering hours, etc. But essentially 25% or 1 in 4 are experiencing that. And we can see, okay, what is the change over time year to year? What is the change over time quarter to quarter? Or do we want to look at this data from a geographical perspective? You might have programs that span across different LGAs, or you may be a larger organization that sort of operates internationally, or maybe just sort of across all of Australia. So we can then start to go, okay, well, let's have a look at all of the data for Victoria. And we can start to see here that effectively 26%, still quite similar. But then another filter we might want to use that we captured, what sector do they work within? So might want to look, how does it compare within Victoria in the education sector to that of the healthcare sector? So again, it's not going to be necessarily data that everybody in the call is going to measure, but hopefully it gives you that sort of visualization on how you can start to apply multiple different filters and slice and dice that data to get really rich insights on sort of the impact that you're delivering. So what we might do is sort of just transition across then onto, rather than a dummy dashboard, go onto a real life use case. So it's the real dashboard. I will put the disclaimer out there that it is dummy data. So it's not their real data in here, but essentially Scope, for those certainly based in Melbourne are probably familiar, a really large disability services organisation based in Hawthorne in Melbourne. They developed a framework that essentially is a survey that covers 9 questions. Each question ties into one of the overarching life domains that they're trying to improve through the services they deliver onto their sort of clients and beneficiaries that they serve. The questions are a Likert scale from 1 to 5. So when you're starting to aggregate this up, it falls nicely into a scale of -2 to +2 across each of those life domains. So what we can see here, very, very high level, across all time points, how are we going across all these life domains, across all the services and all the beneficiaries that we serve. So one group or stakeholder that they actually provide this information to is the board. So this is what they want to see every quarter. So they can essentially come in here, set the time parameters for that particular quarter, and that data would change accordingly. They can extract this dashboard as an image file and then provide that to the board at that board meeting. So that's one example. So other people that they have to report to as well, they have a couple of large philanthropic funds that deploy capital to specific programs. So again, because of the data structure in the back end that you've been able to segregate, the programs you're running, the activities you're running, they can then say, okay, well, we need to report to the philanthropist every 6 months, set that 6-month period, set that particular program, demonstrate how they're performing across those 9 different life domains to their philanthropic funds. So that's another example. And then internally at Scope, obviously, they've got therapists which are very, very hands-on. So anecdotally, they know the impact they're having, but to be able to understand who are they having more impact on across different services that we provide, they've got multiple different filters then they can look at. So one of them is, disability type. So, how are we going for people with an acquired brain injury, in comparison to people with a physical disability, as an example? Or, do we want to look at particular age ranges? Do we want to look at particular state-based or geographical regions, education levels, or whether they're living alone, supported accommodation, or residential accommodation services, or things like gender? So multiple different ways where they can apply one filter or multiple filters to be able to really get those granular insights on that data as well. So I might just stop there and sort of hand it back across to Christian, and if there's any sort of questions that we can run through that people might have, potentially maybe put in the chat box as well. I've not been paying too much attention.
Awesome, Tom. Thank you so much. Yeah, we've had a couple questions come through. One that I tried to answer in the chat, which was, do you have data from your clients about survey response rates, especially in post-program follow-ups? And what I was able to put together there for you, Shan, is regarding survey response rates, it can be tracked, but it's different for every org and largely dependent on how they collect the data. 30% is expected for emails when you don't have a direct relationship with beneficiaries. If you know them, it can be up to 60 to 70%, depending on their engagement with your service. Now, Shan, there was a second part to your question. The data would need to be a valid sample of participants. Any feedback from clients who already use your platform? Tom, any thoughts on that part?
Yeah, so the response rates with surveying anybody always can be a challenge. And that can come down to a few different factors. Number one is understanding your beneficiary and what would be the best method of collection within that environment. If you've got a caseworker and you're face-to-face on a one-on-one basis with the end beneficiary, that could be the best way to ensure that you're actually capturing that data. There's multiple ways within Social Suite where you can utilize additional notifications being sent out. If you send them via email and they haven't completed that within 7 days, send another notification, et cetera, to help with that longitudinal collection. But also one of the major benefits and what's seen, clients have seen increase in response rates is the end beneficiary understanding why they're providing that data. And then it's not just for management reporting process, sharing the reports back down so they understand, what has been their change over time, of the impact of the services that are being delivered. That definitely helps that longitudinal collection.
Her question was, so are you saying that these surveys need to be conducted quarterly to provide data to the board? And I don't think quarterly timing it can be really up to any timing that the organization selects. Thoughts on that, Tom?
Yeah, correct. An organization can decide whether they want to collect data annual basis. In Scope's case, they collect on a 6-monthly basis, but their board meetings are just every quarter. But because that people are coming into their service at different time points, which means that somebody's 6-month follow-up is completely different to somebody that started a month after them. So there's a change on the board report, but they're collecting data every 6 months.
Couple more questions. No problem, Shan. Do you use other measures apart from surveys? Example, evidence of impact.
Yeah, so there's ways that you can look at data and bring different data into Social Suite. Obviously, understanding the outcomes of the end beneficiary, you need to be able to collect that from the end beneficiary through surveys. So that's what's been built within Social Suite to automate the process from survey responses going into real-time dashboards. But what some organizations have done as well is bring external data sets. That could be census. It could be, if they're using a commonly used framework and there's a common data set that's benchmarkable, and they can start to bring that into the dashboarding component to gain that like-for-like comparison to make that data a bit more meaningful as well.
Cool. Completely off topic, but Amina asks, Tom, did you feel the earthquake in Brisbane?
We didn't, fortunately. Or not yet anyway, unless there's one traveling up here. But yeah, touch wood. We haven't felt it up in Brisbane.
Cool. Okay, next question. Does the platform have a problem diagnostic feature?
Yeah, I did see that one come through. Yeah, okay. I was going to ask to clarify. Thanks, Elaine. Yeah, so that's an interesting one because obviously with impact, it's an iterative process, and taking the learnings, it's about revising what you're doing to improve and drive more impact. So again, we won't dive into it now, but Social Suite's got a particular feature where it's got versioning control. So you can start to say, okay, well, this is the impact that's been delivered. These are learnings that we've taken. We've then started to refine and change our framework. But then if you change the framework, then it's not statistically valid to have that direct comparison with the old data. So it makes that clean break. You can stipulate as to why you've changed it, what are the learnings, and then the data collected moving forward from that new framework is essentially that separate data set as well.
Thanks, Tom. Erie asks, does this application can serve only for one project or more? So I think can we have multiple projects on Social Suite?
Yeah, essentially, you can have multiple projects or what we call programs, which is the high level. Each program or project can then contain multiple activities or initiatives, and then you could have as many cohorts or groups of people. So yeah, it's really versatile to segregate what you're doing as an organization as best as possible.
Awesome. Another question came in privately. We're close to get started, but just need a little help. Is there something that Social Suite can do to help us?
Yeah, I think we touched on that earlier, that it's quite common that organizations potentially come to us wanting to get to that end state of dashboards to be able to provide to funders. Again, bit of a journey before that happens. So a section of that journey is knowing what are we actually going to measure that ties back to our mission and goals as an organization, but then working that down to the question answer level. So how can we actually attribute towards those outcomes? So we do run, as I said, a bit of a workshop process with our sort of consulting partners where they can understand, what is your mission and vision as an organization? What are the different programs? And then working back from that to develop that framework as well. So that's certainly something that we can help with.
Great. Donna asks a question related to data jurisdiction. Where is the data stored? Our contracts stipulate the servers must be in Australia.
Yep. Yeah, that's quite common, Donna. So what we've done in the past is request to be stored on the AWS server in Sydney. We're built on the Salesforce platform, so it defaults to APAC, defaults to Japan, but we can request that to be housed and stored on the AWS server in Sydney. And yeah, that's been a common requirement for a lot of government organizations and things like that as well. So.
Erie asks, what is the key success factor for the success using this application? That's a great question and probably has multifaceted answer. But Tom, take it away.
Yeah, multifaceted, as you said, Christine. The first is really understanding what are we measuring, who are we collecting data from, what are the time points, and what is the method of that collection. So really understanding those 4 key points initially. It's then about having the organizational understanding around what are you doing and trying to achieve and why you're doing it. Because, depending on the size of the organization as well, is that management, CEOs, board want this particular report, but ultimately the data has to be collected from sometimes the frontline staff. And if they don't have the buy-in, the understanding as to why they're doing that, then there's not enough data in the reporting as well. So first of all, yeah, the first 4 key points around solidifying that, but really that organizational buy-in. And I would say not bite enough more than you can chew initially. Like start off small and choose a particular area, particular program, even a subset of that program, collect data over time, build dashboards, and then the learnings you'll take, and it's then easier to scale across other areas within your organization. So don't feel that you need to have everything in line across all programs to get going. Just start small and start is the key thing really, is start the process and iterate over time.
Great, thanks, Tom. Tamika asks, do you have any process to align with SDGs, so social development goals?
Yeah, there's definitely ways of doing that. So if we look at the SDGs, obviously 17 high-level outcomes, if you want to call it those, and then generally a lot of people use the iris indicators, which are quite the high level, but it's how then, what is the metric or the question you're asking in order to attribute towards those overarching SDGs. So I might just reshare my screen because we've actually got a dashboard which I didn't show that aligns to the SDGs. So you can define what are the outcomes that we're trying to achieve, and then tying that back to one of those overarching SDGs. So in this case, the outcome here is people have reported experiencing difficulty meeting basic needs such as food, clothing, shelter in the last 3 months. Essentially, since 2015, there's been a 20.1% decrease. And then we're just tying that back for a visualization perspective to that no poverty overarching SDG as well.
Great, thanks, Tom. Any final questions before we wrap up today? Okay, well, we'll just conclude here. Well, thanks, Tom. Thanks for your demo today. And thank you, everyone, for your great questions. It's great to have you all here. We'd love to connect with you. We'd love to book a meeting with you. We can do a short discovery meeting, walk you through the product, answer any more of those detailed questions for you. Tom is available. His contact information is below. And as Tom mentioned earlier, we're really here to support you through the entire journey of outcomes and impact measurements, whether that's just getting started and helping you by introducing you to one of the M&E experts within our network, or if you just need a little bit of help and a little bit of refinement, Social Suite would be happy to absorb the cost of a workshop with one of our M&E consultants that we work with to help you get started and to help you begin your journey with outcomes and impact measurements. So we're here to support you through every step of the way, and we'd love to talk to you. Thanks, everyone, for your time today. It's been fantastic, and hope everyone is safe in Melbourne with the earthquake. And yeah, we hope to talk to you soon. Thank you.